So my name is David Wood. I'm Professor of Cardiovascular Medicine at Imperial College London, based at the International Centre for Circulatory Health. Secondary prevention is a top priority, and by that I mean that patients who have developed vascular disease, whether it be coronary disease or stroke or peripheral arterial disease, are at very high risk of recurrent disease and of dying from the disease. And the evidence base, the scientific evidence base that we can reduce that risk through appropriate lifestyle interventions and drugs is among the best of any aspect of clinical medicine. The challenge is to actually deliver that care, to translate that evidence into effective patient care. The first challenge is, I think, to recognize the importance of secondary prevention and then to develop national guidelines which clearly prioritize patient groups and thresholds for treatment and treatment targets. But beyond the guidelines, we need models of care. In other words, we need to provide evidence-based models of care, whether these are led by cardiologists or nurses and allied health professionals, which can deliver smoking cessation, healthy eating, physical activity programs, as well as the management of blood pressure and lipids and glucose, and importantly, adherence with lifelong medications. By prioritizing secondary prevention, the benefits for the country as a whole are huge. This is a patient population that has already identified itself. They present with symptomatic disease, they are at high risk of recurrent disease, and we can reduce that risk substantially. So by investing in secondary prevention, we make a big impact on the overall burden of cardiovascular disease in the population.